repetitive transcranial magnetic stimulation, or rTMS for short, and as the name suggests, we use magnetic stimulation or magnetic field to stimulate the brain tissues. It is used transcranially, so a probe is kept over the scalp of the patient and repetitive magnetic pulses are sent to the brain tissue. Now, we have to understand that it is a non-invasive procedure, so the patient does not have to undergo any kind of procedure or cut or any anesthesia. The patient has to simply sit on a chair comfortably, and the probe is held on the top of the scalp and magnetic pulses are sent. Now, this procedure can last anywhere between 30 minutes to 50 minutes depending upon the condition that we are looking at. And the patient has to kind of repeat this procedure once a day for a number of sessions. It can last for few days to few weeks, and this is the thing that is discussed between the patient and the treating doctor. Now, how it works is very important for us to understand. These magnetic pulses, they kind of stimulate that part of the brain which has been understood that they have become inactive. So it activates those brain tissues. Indications for rTMS, it is used for treatment-resistant depression and also treatment-resistant obsessive-compulsive disorder. In both these conditions, when the patient has taken the traditional treatment, which includes pharmacotherapy and psychotherapy. In pharmacotherapy, they have used the good dosages of medication and combination of medicines, and still the patient does not show any improvement. That is when rTMS is advised to the patient. Few of the preliminary tests that we do before starting rTMS is the counseling of the patient and then doing an EEG of the brain. Now, EEG is done because in certain cases we have to rule out any seizure disorder, and in this condition we just have to be generally careful around using rTMS. Few of the side effects that we have to be careful about is scalp tenderness or tingling sensation in the fingers, which is generally self-limiting, and the other common side effect is post-procedure headache, which is also self-limiting, and if at all it requires some bit of painkiller. So all in all, when used in conjunction with medication, with psychotherapy, rTMS is considered a very safe and effective way of managing treatment-resistant depression and treatment-resistant OCD.